Hi folks, I'm Tim Murphy, inventor of the Cozy Curvy Restorative Pillow. And I'm here at Elkridge Chiropractic to speak with Dr. Plotkin.
Hey Tim, how are you?
Nice to meet you.
Nice to meet you too.
And full disclosure, my niece Annie and her husband John love Dr. Plotkin. They can't speak highly enough about him.
They're long-time patients, and honestly, I can't say enough good things about them either. So
okay, great.
It's kind of a mutual feeling.
Yeah, and so obviously they love him because he's alleviated their pain. And so when I told Ani about my Cozy Curvy pillow, she said, "You just got to show it to Dr. Plotkin." So here I am.
Yes, I'm looking forward to seeing it and learning all about it. So I've been practicing for 27 years. I think I mentioned that earlier. So I went to chiropractic school in Chicago. That was back, and I graduated in 1993. A long time ago. I'm an undergraduate. I did actually at Towson State University.
Nice.
Before it was Towson University. I also, as far as other things I've done over time, I have a certified strength and conditioning specialist. I have some background as far as a sports nutrition certification as well. I work and teach at the University of Maryland. I've been teaching in the Kinesiology Department there for the past 13 years. And I've also been one of the team chiropractors for the past 13 years.
We are very interested in helping our audience identify if they are a good candidate for our pillow. What kind of issues do you see the Cozy Curvy being helpful in addressing?
And here's a great example because I was just kind of talking about this. So normal spine, normally you should have a curve, a nice smooth curve in your neck in the back. If you look from behind, it should be straight up and down. So if you kind of look, and this is a great way to look at it, if I lay myself down on the back, you can see how that curve supports that natural curve in the neck, which is fantastic. If I move and that person lays on their side, what you're trying to do is keep that in line with your spine, which keeps it straight like this. So those two things are pretty important. Very commonly what happens with people, we talked about a straight neck, is basically this happens. So this is my best visual aid ever because this is representing the muscles in your neck. When you have a nice curve, muscles are relaxed. If you lose some of that curve, muscles are very tight. So if we're laying on a pillow at night and we can lay on our back, some people can, some people can't, what that does is it promotes that natural curve. So if you're laying, let's say you lay on your back for 6 hours on a natural curve, it's going to let some of that natural curve settle back in your neck. Whereas if you lay with your head like this all night, it's going to promote that. And that's what we're trying to avoid. So that's actually one of the concepts I really like about this pillow. The other thing is when you lay on your side, you want to keep your head in line with your spine. So what happens a lot of times is people end up like this because they're laying on too much pillow, or they're laying like this because it's not enough pillow. So the concept is the way that you have this designed actually works well to support you on your side, which is basically the two best positions to sleep in, or on your back or your side.
Very good.
Stomach's a no-no. I know a lot of you don't want to hear that, but
Are there any sports injuries that could benefit from this pillow?
sports injuries in general, I mean, if you think about football players, when they're running on down the field and they hit somebody, you know how important concussions are these days. Well, you fall down, you hit your head, that's a whiplash injury. So very commonly when your head gets whiplashed, those muscles tighten up, you lose some of that natural curve. So anything that helps promote some of the natural curve is going to promote natural relaxation of the muscles. And again, when you're back, great position. On your side, great position, as long as you have the proper support.
Very good.
One thing I will tell you specifically about this pillow that I really like, because I've seen there's plenty of other pillows out there, is the fact that it is completely open in the center. I've seen other ones that have curves, not as comfortable, but then they also have the center built up, which kind of defeats the purpose. So what you're trying to do is promote the curve. It's funny because I think I was telling you that I always tell patients, if you go away and there's a crappy pillow, take a towel, roll it up till it's about the width of your forearm, put it behind your neck, and sleep with no pillow. Basically this concept, which is awesome.
Thanks. And this open area is not restrictive. You can turn your head right, left, forward, and back. It's super comfortable. And when you turn on your side or shoulder and hip, you're not pivoting like a ballerina. Again, you're pivoting on your shoulder. So this is the path your head would turn. It looks like, how can I turn?
It's funny because it looks high, but when I lay down on it, it's not high. It's actually, it flows very well.
Yeah, very good.
Yes.
And I also thought, I get people go, well, I don't sleep on my back. Well, if you sleep on your right side, how do you get to the left side? And this will keep your neck in that position that you had mentioned and supports you along that path. So that's kind of part of the concept with it.
Which is good. And another thing I'll tell you, the thing you can recommend with the pillow is, even if they see I sleep on my side, that's fine. But you know what? 20 minutes a night before you go to bed, lay on your back on that. Because just 20 minutes a night of laying on that curve will help relax things.
Or meditate for
Exactly, for 20 minutes.
a
Whatever
quick
you
nap.
need to do to get in that position.
I'm a musician, and I know other sax players wearing a strap, carrying around a tenor or a baritone, and they go to a bracket or whatever, a brace harness, they call it.
Right.
And also, violinists, I work with a lot of violinists, and they got their head like
Constantly,
yeah, so they've got lots of issues too that hopefully this could benefit. Obviously, they must see you, because I know they do. They tell me.
Boy, we definitely work with a lot of neck pain, there's no question.
Yeah.
But again, from our standpoint, all we try to do is restore motion, and then you do the things on your own to maintain it, and that's what this does. This helps a lot. From what I can see, like I said, and full disclosure, I was just introduced to this 20 minutes ago. I like it.
Okay.
I like it a lot. It seems like it would be a very a good concept, and I think patients would love it too.
Dr. Plotkin, thank you so much for examining Cozy Curvy and giving us your assessment. We really appreciate that.
My pleasure. I'm glad I could help, and I'm glad I could take a look at it.
And may Elkridge Chiropractic continue to provide great care
Absolutely.
for our community.
Absolutely.